na. Let's go live. Okay, got it.
Got it.
Send me the link, please.
Yes po, Doc. Processing na po.
Okay, Lisette, tulong na lang sa YouTube. Charmaine, tulong sa chat box. Thank you. Okay, Lisette, tulong na lang sa YouTube. Charmaine, tulong sa chat box. Thank you.
Tatawagan ba na?
Sa YouTube.
Para girl, have you
Uh,
talked to Dr. Chet ba?
Thank you.
Hindi pa siya nagre-respond. Tatawagan ba na?
Sa YouTube.
Para girl, have you talked to Dr. Chet ba?
Thank you.
Not yet.
Hindi pa siya nagre-respond. Tatawagan ba na?
Sa YouTube.
Para girl, have you talked to Dr. Chet ba?
Not yet.
Hindi pa siya nagre-respond. Tatawagan ba na? Para girl, have you talked to Dr. Chet ba?
Not yet.
Hindi pa
Why am I hearing the live and the YouTube?
Tatawagan ba na? Para girl, have you talked to Dr. Chet?
Not yet.
Why am I hearing the live and the YouTube?
Tatawagan ba na? Para girl,
Not yet.
Why am I hearing the live and the YouTube?
Bakit parang paulit-ulit?
Oo nga. Kala ko ako lang eh.
Sabi ko, tatlong beses bang sinabi ni Bambi yun?
Bakit paulit-ulit?
Paulit-ulit.
O yan, paulit-ulit na naman tayo dyan.
Sabi ko, tatlong beses bang sinabi ni Bambi yun? Uy, ako yun. Paulit-ulit.
Bakit nga ganon?
Oo. Nag-ano na siya, nagpe-play na siya eh. Teka ha.
Baka mamaya ganon din mangyari sa atin.
Nga, parang nag-e-echo.
Hindi na echo talaga umiikot eh.
Just turn off your YouTube na lang muna. I mean your, don't connect to YouTube, please.
I'm not. But hindi ko lalagay yung live on YouTube. Kasi
Don't connect because you're hearing the delay on YouTube.
how do I disconnect? I didn't naman do anything kanina. Kaya lang, there is a YouTube nakalagay.
Wala tayo sa Facebook Live.
Sabay po, sir.
So is this running already? Are we running already? So Judith, i-queue mo na lang kami kung kailan kami papasok. Pati ako naguluhan na.
So we're on FB and YouTube live. Tama. Tama.
Are we letting people in already?
45. Yeah.
Nag-Fiber Plus pa ako eh. Oh.
We're not Chet. Andiyan na pala si Chet eh. Okay.
Yes, ma'am, people are in.
Are we letting people in already?
They're inside na, most of them.
Ang COVID-19 virus ay airborne. Ibig sabihin,
wait
sumasama ito sa ating hininga.
Can we let na the
Lumulutang,
press
tumatagal,
in?
naiipon, at kumakalat ito sa mga
Can we
kulog
see
na
Dr.
lugar.
Chet?
Sa ganitong lugar, kung mayroon taong may COVID,
Dr.
ang
Chen,
hininga niya ay maaari
the audience can hear
malanghap
us daw.
pa. Para maiwasan
Yes.
ito, kailangan pa rin ang apat dapat. Subalit kung nasa kulob na lugar, maaaring hindi na sapat ang 2
there.
metrong physical distancing. Ang naipon na virus pwede nang tumagos sa mask at face shield. At kahit di umabot ng 15 minuto ang pakikipag-usap, maaari pa rin makahawa. Hindi
Please
sapat na
rename
umasa sa tatlong ito.
Dr. Chet.
Sa apat dapat, pinakamahalaga ang air quality. Sanayin natin na umiwas sa kulob na lugar, pati na rin kung saan maraming tao. Kung hindi maiwasan ang kulob na lugar, siguraduhin na maganda ang ventilasyon dito. Buksan ang mga bintana at pintuan upang lagusan ang daloy ng hangin. At kung maaari, magbukas ng electric fan at iharap palabas para manatiling sariwa at malinis ang ating hinihinga. Sa pagpapabuti ng air quality ng isang lugar, mas magiging epektibo ang physical distancing, pagsuot ng PPE at mabilisang pakikipag-ugnayan sa tao. Tandaan, sa apat dapat, pinakamahalaga ang air quality. Ito'y isang munting paalala mula sa inyong nagmamahal na mga healthcare workers. Ang COVID-19 virus ay airborne. Ibig sabihin, sumasama ito sa ating hininga. Lumulutang, tumatagal, naiipon, at kumakalat ito sa mga kulob na lugar. Sa ganitong lugar, kung mayroon taong may COVID, ang hininga niya ay maaaring malanghap ng iba. Para maiwasan ito, kailangan pa rin ang apat dapat. Subalit kung nasa kulob na lugar, maaaring hindi na sapat ang 2 metrong physical distancing. Ang naipon na virus pwede nang tumagos sa mask at face shield. At kahit di umabot ng 15 minuto ang pakikipag-usap, maaari pa rin makahawa. Hindi sapat na umasa sa tatlong ito. Sa apat dapat, pinakamahalaga ang air quality. Sanayin natin na umiwas sa kulob na lugar, pati na rin kung saan maraming tao. Kung hindi maiwasan ang kulob na lugar, siguraduhin na maganda ang ventilasyon dito. Buksan ang mga bintana at pintuan upang lagusan ang daloy ng hangin. At kung maaari, magbukas ng electric fan at iharap palabas para manatiling sariwa at malinis ang ating hinihinga. Sa pagpapabuti ng air quality ng isang lugar, mas magiging epektibo ang physical distancing, pagsuot ng PPE at mabilisang pakikipag-ugnayan sa tao. Tandaan, sa apat dapat, pinakamahalaga ang air quality. Ito'y isang munting paalala mula sa inyong nagmamahal na mga healthcare workers. Ang COVID-19 virus ay airborne. Ibig sabihin, sumasama ito sa ating hininga. Lumulutang, tumatagal, naiipon, at kumakalat ito sa mga kulob na lugar. Sa ganitong lugar, kung mayroon taong may COVID, ang hininga niya ay maaaring malanghap ng iba. Para maiwasan ito, kailangan pa rin ang apat dapat. Subalit kung nasa kulob na lugar, maaaring hindi na sapat ang 2 metrong physical distancing. Ang naipon na virus pwede nang tumagos sa mask at face shield. At kahit di umabot ng 15 minuto ang pakikipag-usap, maaari pa rin makahawa. Hindi sapat na umasa sa 3 ito. Sa apat dapat, pinakamahalaga ang air quality. Sanayin natin na umiwas sa kulob na lugar, pati na rin kung saan maraming tao. Kung hindi maiwasan ang kulob na lugar, siguraduhin na maganda ang ventilasyon dito. Buksan ang mga bintana at pintuan upang lagusan ang daloy ng hangin. At kung maaari, magbukas ng electric fan at iharap palabas para manatiling sariwa at malinis ang ating hinihinga. Sa pagpapabuti ng air quality ng isang lugar, mas magiging epektibo ang physical distancing, pagsuot ng PPE at mabilisang pakikipag-ugnayan sa tao. Tandaan, sa apat dapat, pinakamahalaga ang air quality. Ito'y isang munting paalala mula sa inyong nagmamahal na mga healthcare workers.
This media conference is being recorded by the organizers for the purpose of documentation. Unauthorized recording or streaming of the proceedings is prohibited and punishable by law. Please keep your microphones on mute at all times. For those in Zoom who wish to ask a question live on mic, please raise your hand and wait to be acknowledged. Please introduce yourself before asking your question. You may also type your question on the Zoom chat box. For those watching on YouTube, please type your questions on the comment section. For our media partners, please rename yourselves to include your affiliation. Example, media, affiliation, name. Let us put ourselves in the presence of the Lord. Dear Father, we thank you for everyone gathered here now. Thank you that you know each of us by name and have caused us to walk with you. We say that we are dependent on you and our trust in you completely. As we surrender ourselves in adoration, we welcome you amongst us today and celebrate the gift of life that you have lavished upon each of us. We ask that you would open our ears so that we may hear your voice, open our minds so that we may receive your eternal wisdom. Open our spirits so that we may know your leading and guidance, and open our hearts so that we may receive your wonderful love. We pray that you fill them with courage and give them your peace. We ask this in the glorious name of Jesus. Amen.
Pediatricians, we are gathered here and afar, called to offer our lives for a cause. For our children, we strive to sustain health and life. Dedicated, we rise to this cause. To the call we respond. With our vision we launch, all the children of the land, we vow to serve and far beyond. For God's tender, loving hand we proudly stand. To the call we respond, with our vision we launch, all the children of the land, we vow to serve.
So good morning, everyone, especially our Tri-Media friends. I'm Dr. Casala, the chair of the PPS Press, or the Public Relations Engagement System Services. And in behalf of the Philippine Pediatric Society President, Dr. Jocelyn Eusebio, we welcome you all to this PPS Media Conference on COVID-19 vaccination for children 5 to 11 years of age. So last 25 November 2021, some of you might still recall, we met up for a media conference on COVID-19 vaccination concerns in children when the government started the rollout of the vaccination for 12 to 17 adolescents group. And here we are now again for the 5 to 11 age group, the rollout of which started yesterday after a little delay. But 2 years into the pandemic, where are we now? 3.6 million cases of COVID-19, with 54,000 deaths. Under Republic Act 11525 of the COVID-19 Vaccination Program, Act of 2021, initiated March 1, 2021, we have already administered a total of 128 million doses, both for adults and adolescents, primary, series, and boosters. This is still a far cry from reaching herd immunity for a population of 110 million. So much fear and anxiety still plague this the general public, with vaccine hesitancy hindering the movement of our national vaccination program. Now, the Philippine Pediatric Society, along with the Pediatric Infectious Disease Society of the Philippines, issued a joint statement recommendation for the COVID-19 vaccination in children, especially the 5 to 11 years age group, last February 4, 2022. The Philippine Medical Association is one with the PPS and PIDSP in supporting the statement. The Philippine Foundation of Vaccination and the Philippine Society of Allergy, Asthma, and Immunology further lend in their technical support and expert knowledge. This statement will be read by our esteemed panel of speakers, and you can also read it in its entirety at our PPS website, pps.org.ph. This media conference is a chance for the media to ask their questions for our experts to answer, so that our media friends may help us clarify issues to the public with the right science-based information. The PPS membership will likewise have its own forum sometime next week for all concerns on COVID-19 vaccination. Today, however, is the media conference. So without further ado, I'd like to call in my co-chair, Dr. Cristina Tambolyong Paras, to introduce our expert panel of speakers. Tina?
Thank you, Dr. Casala. Good morning to everyone with us in Zoom, as well as those tuned in on Facebook and YouTube Live. I'm Dr. Cristina Tambolyong Paras with the PPS Press, introducing our distinguished panel of speakers. Our first speaker is Dr. Jocelyn Eusebio, the beloved president of the Philippine Pediatric Society. She will be joined shortly by Dr. Mary Ann Bunyi, the president of the Pediatric Infectious Disease Society of the Philippines and a member of the National Immunization Technical Advisory Group. We are very grateful that the president of the Philippine Medical Association is joining our media conference, Dr. Benito Atienza. And to share a brief message is the president of the Philippine Foundation of Vaccination, Dr. Maria Liza Antoinette Gonzalez. Our final speaker is Dr. Romel Lobo, the president and board examiner of the Philippine Society of Allergy, Asthma, and Immunology, and co-chair for the National Adverse Effect Following Immunization Committee. So let's begin. Let's call on Dr. Jocelyn Eusebio.
Thank you so much, Teen, and good morning to everyone. After almost 2 years, we have coexisted with the pandemic, trying our best to make our lives normal as we wear face masks, practice social distancing, and practice hand washing after almost every encounter with others. Upon the introduction of COVID-19 vaccination a year ago, things moved a little. Hope glimmered in the horizon, and the promise of a slow return to a better normal became a real possibility. But the road to population protection is hindered by variables within and beyond our control. Sadly, together with the unpredictability of vaccine supply comes the surprising rise of people who not only oppose vaccination, but more importantly, condition the minds of the public to assume a similar viewpoint. As a response to the growing need to address the issues raised by this segment of our population, allow me to read the position statement of the Philippine Pediatric Society, supported by the Pediatric Infectious Disease Society of the Philippines. First, let us be clear and unequivocal. COVID-19 disease directly affects children and may lead to serious consequences. Children 5 to 11 years of age are at risk of severe illness from COVID-19. Multi-system inflammatory syndrome in children, otherwise known as MIS-C, is most frequent among children 5 to 11 years old. Unfortunately, some of us in our practice have already encountered a few pediatric patients with MIS-C, a few of whom have succumbed to the illness. Other post-COVID conditions have also been seen in this age group, including long COVID. The majority of children infected with SARS-CoV-2 present with asymptomatic or mild disease, MIS-C and post-COVID conditions can and typically occur after asymptomatic or mild infection. There are also indirect effects of the COVID-19 pandemic on children, including worsening of their mental or emotional health, widening of education gaps, decreased physical activity, and increased body mass index, decreased routine immunizations, and increase in adverse childhood experiences or ACEs. Thus, broad vaccination implementation would reduce the public health burden of COVID-19 in children 5 to 11 years of age. Like many regulatory agencies around the world, the Philippine Food and Drug Agency, or FDA, has approved the use of Pfizer-BioNTech COVID-19 vaccine for use in this age group after a rigorous and independent review process. Other expert groups, such as the Vaccine Expert Panel, the Health Technology Assessment Council, or HTAP, PPS, and PIDSP, have reviewed and endorsed COVID-19 vaccination in the same age group after weighing all available evidence on the benefits versus the risks of the vaccine. We would like to highlight the following. In the pivotal trial of the vaccine conducted among children ages 5 to 11 years, the vaccine was found to be safe and efficacious, having prevented 90.9% of symptomatic COVID-19. No serious adverse events nor deaths were found related to the vaccination. After vaccine implementation of approximately 8.7 million doses in children aged 5 to 11 years in the US in 2021, there were few reports of adverse events in this age group. Serious adverse events were rarely reported, though local and systemic reactions were reported as expected. Common side effects such as pain at the injection site, fatigue, and headache were mild and brief. These are normal signs that the body is building protection. There were only 11 cases of myocarditis reported out of the 8.7 million, most of whom had a mild clinical course and have recovered. No deaths have been causally associated to the vaccine. Recent data from US experience also show that 2 doses of the vaccine reduced the likelihood of MIS-C by 91%, and that 95% of children hospitalized for MIS-C were unvaccinated. We therefore reiterate that vaccination is the best way to protect children from COVID-19 and its complications. COVID-19 is now vaccine preventable. We are glad that as a nation, we were able to extend the protection given to adults and adolescents to now include children as young as 5 years old. Parents and guardians of children aged 5 to 11 years are enjoined to discuss vaccination with their healthcare provider and obtain their information from reputable sources with the right experience and expertise. We also call on the media to work with us hand in hand in providing scientific evidence-based information. Vaccination is the most effective way to prevent COVID-19. Rest assured that as vanguards of the health of the Filipino child, the PPS and PIDSP will continue to monitor data on vaccine safety, efficacy, and effectiveness, and will provide updates as needed to guide COVID-19 vaccine recommendations in children. Now, I would like to emphasize this to our parents, most especially, mga minamahal kong mga magulang, ang pagbabakuna po ay isang ligtas na pamamaraan upang pangalagaan ang kalusugan ng ating mga anak laban sa COVID-19. Bagamat maikli ang pag-aaral sa mga bakunang ito dahil sa matinding panganib na dala ng SARS-CoV-2 at sa malaking hamon na malagpasan ito, ang pagbabakuna ang isa sa mga siguradong paraan upang di lumala ang pagkakasakit at tuluyang mapuksa. Tandaan po nating lahat, ang bakuna ay panlaban, hindi kalaban. Kalusugan para sa lahat, kalusugan una sa lahat. Thank you. And now I would like to call on Dr. Mary Ann Bunyi, the President of the Pediatric Infectious Disease Society of the Philippines. Take it away, Mary Ann.
Magandang umaga po sa lahat. Pwede ko po bang makita yung unang slide? Alam ko po na yung statement ng PPS at ng PIDSP ay nailathala na po sa iba't ibang dyaryo. Nasabi na rin po kanina ng Pangulo ng PPS. Gusto ko lang pong bigyang diin at ulitin na ang Philippine Pediatric Society at ang aming organisasyon na Pediatric Infectious Disease Society of the Philippines ay kaisa at sumusuporta sa programa ng pamahalaan na bigyan ng bakuna ang mga batang may edad 5 hanggang 11 taon laban sa COVID-19 virus. Next slide, please. Maraming di kanais-nais na epekto ang COVID-19 sa mga bata. Oo, totoo, banayad ito sa kabataan, pero may mga bata kaya na maaaring magkaroon ng malubha at maging malala ang sakit nila na dahilan kung bakit sila mauospital. Isa sa mga nakakatakot na komplikasyon ng COVID-19 na tinatawag nating multisystem inflammatory syndrome in children ay madalas nakikita sa edad 5 hanggang 11 taon. At ito ay pwedeng mangyari hindi lang sa mga batang may COVID na naospital, ito ay maaaring mangyari sa mga batang na-infect na walang sintomas or mga batang nagkasakit na may banayad lang na sintomas. Noong January 31, 2022, meron nang nai-report na 6,851 na nagkaroon ng MISI sa CDC. At ang pinakamataas na numero na nakitaan dito ay doon sa edad 5 to 11 years old. Sa isang artikulo rin na aking nabasa, from June 2020 to February 2021, meron ng 614 na mga bata sa 32 bansa. Kasama na dito yung mga low to middle countries na nai-report na nagkaroon ng MISI. Dito sa Metro Manila, magmula 2020 hanggang 2021, merong nailathalang 34 na mga bata sa 3 public tertiary hospitals at 22 na mga bata sa 2 malaking private hospitals. Ang karamihan ng mga batang ito ay tinamaan ng edad 5 at 8 taong gulang. Bukod dito, ang nangyayari lumalala ang mental health situation ng mga bata na natatagalan magbukas ng face-to-face ang mga eskwelahan dahil ang gusto natin maging ligtas ang mga bata dito, na babawasan ng physical activities ng mga bata at nagkakaroon ng panganib na magkaroon ulit ng sakit ang mga batang ito laban sa ibang sakit na pwedeng maiwasan kapag binigyan mo ng ibang bakuna laban sa COVID-19 dahil hindi na sila nabibigyan dahil na-disrupt na yung pagbibigay natin ng routine immunization. Next slide, please. Maraming benepisyo ang pwedeng maibigay ng pagbabakuna ng COVID-19 kay dito sa edad 5 hanggang 11 taon. Doon sa phase 2, phase 3 clinical trial na ginawa, nakitaan doon na makakaiwas ang mga bata na magkaroon ng symptomatic COVID-19 by 91%. Yung ikinatatakot natin na myocarditis, pericarditis, or anaphylaxis ay hindi nakita doon sa pag-aaral na yon. Directly, ang mga bata kapag nakatanggap ng bakuna laban sa COVID-19 ay maliligtas na magkaroon ng COVID-19 na sakit at ang mga komplikasyon na nakasama doon sa pagkakaroon ng COVID-19 illness. At indirectly, ang face-to-face classes maaari nang mapagpatuloy ng mas ligtas na kapaligiran, maibalik yung mga pangkaraniwan na mga ginagawa ng mga bata, makapagbakasyon, makalabas at makapaglaro sa kanilang mga kaibigan, magkaroon ng mga field trips kapag nasa school na sila, camping at iba pa. Yun lang po. Maraming salamat po. Ang susunod pong magsasalita ay si Dr. Benny Atienza, ang PMA President po natin.
Magandang umaga po sa inyong lahat, sa lahat ng ating nakikinig at nanonood po sa araw na ito. The Philippine Medical Association is the mother organization of all the physicians in our country, the Philippines, composed of more than 80,000 members in each roster, 119 component societies, the basic unit of the Philippine Medical Association in 17 regions from all over the country, all major cities and municipalities of the country, as far from North as Batanes and Babuyan Islands, and General Santos City in the south. We have 8 major specialty divisions, 91 specialty and subspecialty societies, and there are 38 affiliate recognized by the Philippine Medical Association. As early as January 2021 last year, we issued a position paper of the Philippine Medical Association on the nationwide vaccination program. The Philippine Medical Association will take the following steps for its participation in the vaccination program. We conducted an information campaign to increase the public awareness as to the need for the vaccination, assist in the vaccination complying with the government's list of priorities, monitor the effects and adverse reactions of the patients already vaccinated, and lastly, we report to the Department of Health whatever adverse reactions and other information gathered by the individual physicians during and after the vaccination. For your information, the Philippine Medical Association is the one who suggested the national vaccination days done last November and December of 2021. And now I will read to you the Philippine Medical Association statement on the vaccination of children 5 to 11 years old. This is the first time po maririnig po ninyo to. It will be released today po. It was signed by the national officers of the Philippine Medical Association and all the 17 governors all over the country of the Philippine Medical Association. The Philippine Medical Association expresses its full support for the Department of Health, the National Task Force Against COVID-19 in their program providing the COVID-19 vaccines in children aged 5 to 11 years old. As mentioned by the joint statement of the Philippine Pediatric Society, the Pediatric Infectious Disease Society of the Philippines, COVID-19 directly affects the children. While it is true that most present as mild as asymptomatic cases, some may develop more serious consequences such as multisystem inflammatory syndrome in children and even death. In addition, the pandemic has already adversely affected the growth, mental health, learning, and health-seeking behaviors of children and their families. The available COVID-19 vaccines for children aged 5 to 11 years have undergone extensive evaluation from the United States Food and Drug Administration. They have been granted Emergency Use Authorization or EUA by the Philippine Food and Drug Administration or FDA. They have been found to be safe and effective in preventing symptomatic COVID-19 and its complication. Providing COVID-19 vaccines will help reduce the disease burden in this age group. Thus, the Philippine Medical Association supports the DOH, the National Task Force, in their efforts to protect the Filipino children against the COVID-19 through vaccination. The PMA agrees with the PPS and PIDSP in encouraging the parents to discuss their concerns regarding vaccination with their health care provider. The Philippine Medical Association also urges the media and general public to exercise good judgment, to obtain and disseminate information only from reputable sources. The PMA continues to call for all members of the eligible population groups to get vaccinated and exercise health protocols in order for our country, the Philippines, to help and recover as one. Tayo po'y matakot sa COVID-19, huwag sa bakuna. All for the Filipino child. PMA working together as one with the PIDSP, PPS, DOH, IITF, WHO. Maraming salamat po at magandang umaga po sa inyong lahat.
Hello, good morning.
Good morning.
Yeah, should I start?
Yes, go on, Chet.
Okay, sige. So
Thank
I'm
you.
Dr. Lisa Gonzalez. I'm the president of the PFV. We're actually working on our statement, but I was requested to present data on the efficacy for the vaccine, COVID vaccines for the 5 to 11 age group. So I'd like to share some slides, just a very short presentation. Okay, so I hope that you can see my slides. Okay. So, First of all, this is my beginning slide because I'd like to say at the start that the PFV supports the recommendation of the PPS and PIDSP for vaccinating children aged 5 to 11 years against COVID-19. And we also fully support the DOH program of vaccinating this pediatric age group. We all know that vaccination is the most effective way to prevent COVID-19 infection, and vaccination of children and adolescents is one of the most impactful public health measures in our country. So these are the countries where EUA have been given for the COVID vaccine for this age group, 5 to 11 years old. And actually, this involves many countries worldwide. And in the Philippines, the Pfizer vaccine was actually already granted an EUA in December 22, 2021. Okay, so the basis. So it has been mentioned that there's been this landmark or pivotal study on the use of the COVID vaccine for children 5 to 11 years of age. And what is this study? This is actually a study which combined a phase 1, meaning it's a dose finding study to determine the best dose, and a combined phase 2 and 3 randomized trial. So it is an ongoing study because they hope to get data from actually children from the age of 6 months to 11 years. But we only have data at this time for the 5 to 11 year age group, and we will await the data for those who are even younger than 5 years because it is still ongoing. So in the phase 2 to 3 trial, they randomized around 3,000, so 2,268 children to receive 2 doses of the Pfizer vaccine 21 days apart, and compared this to those who were not given the vaccine, so placebo. And vaccine efficacy was determined 7 days or more after the second dose. Okay, so from the phase 1 study, it was determined that the 10 microgram dose is the best based on reactogenicity and immunogenicity. So this dose is 1/3 the dose that is used in adults, so 30 micrograms in adults. And in the phase 2 to 3 trial, it showed that the 10 microgram Pfizer mRNA vaccine had a favorable safety profile with no vaccine-related serious adverse events. Okay? And vaccine efficacy was determined 2 ways. One is the immunobridging approach, wherein they compared the neutralizing antibody titers in the 5 to 11 year age group to those in the 16 to 25 year age group where efficacy has already been determined. And another way to determine vaccine efficacy is to determine how many would develop symptomatic COVID-19 in those who were vaccinated compared to those in the placebo. And that's where the frequently quoted 91% vaccine efficacy comes from. So this is just a slide showing, first of all, that the geometric mean titers in the 5 to 11 year age group is comparable to the 16 to 25 year age group. So this implies that it would be as effective as the older age group. And vaccine efficacy or protection against developing symptomatic COVID-19 is 91% or 90.7% to be exact among all those who were given the vaccine, regardless of whether they had previous disease, they were previously infected with COVID-19 or not. I will touch a little bit about safety, but this will be discussed later on by the next speaker, I think. So in this clinical trial, and it has also been mentioned, there were no serious side effects. Most of the side effects were local injection site reactions, which is common even with the other routine vaccines that we give. And also among the systemic manifestations, headache, and fatigue were common. And to expand on that, we have real-world data actually, because in the United States, more than 8 million doses of the vaccine have already been administered. And so far, the side effects that they saw were similar to what was seen in the clinical trials. So no safety or warning signs were observed. Okay. And as mentioned earlier also by the other speakers, most of the side effects were mild, and then myocarditis was observed in 11, but remember that myocarditis can occur not necessarily because of the vaccine, but because of other viruses. And in fact, it can even occur at a greater risk among those who develop COVID. But anyway, 11 out of the 8 million, that's only 0.0000013 or 0.00013%. So it's really rare. It's really very rare. So it's nothing to be concerned about if that is the concern. So what are the benefits? It will direct benefits would be the prevention of COVID-19 and its complications, MIS-C, hospitalizations, even deaths, and the short and other short-term and long-term complications. Next, which has been, I think, emphasized by the earlier speakers, it has many important indirect effects. So it will mitigate physical, mental, emotional effects that results from the prolonged disruption in school, participation in sports, and other social activities that are key to child and adolescent health and mental well-being. And lastly, it will reduce the transmission. So children can act as reservoir. And even if they develop mild infection, there is this risk that they will transmit the disease to other family members or household contacts. And these household contacts may actually be the vulnerable population that may be at higher risk of developing severe complications. So widespread vaccination of this age group is key to attaining our herd immunity. So in summary, children and adolescents represent a growing proportion of this new COVID-19 cases. Children and adolescents can experience serious outcomes and can transmit SARS-CoV-2. We have the vaccines that have been shown to be effective and safe. And these are important tools that we can use to control the pandemic. Vaccinating children and adolescents has the potential to reduce disease burden in the pediatric population, and vaccination of children and adolescents against SARS-CoV-2 is the only way to move forward towards reducing COVID-19 morbidity and mortality. So thank you very much for your attention.
Good morning. My task for this morning as Vice Chair of the National Adverse Events Following Immunization is to present the safety data. But since we're tackling 5 to 11 age group and we just started yesterday, actually yesterday we did not have any encountered any adverse event in our institution where we rolled it out. So I would like to present some safety data from countries surrounding us. But in order for us to understand, let me first orient you with the two preparations of your tosinamiren COVID-19 mRNA vaccine, or Comirnaty. The one used for the pediatric population 5 to 11 years of age contains a 10 microgram dose concentrate for dispersion. On the other hand, for the 12 years old and older, it contains a 30 microgram dose concentrate for dispersion. Now, next slide, please. If you look at, sometimes we ask ourselves, what are the contents of this vaccine that may cause an allergic reaction? Well, potential allergens include, as you see in the bottom of the screen, for your preparation for 12 years old and up is your polyethylene glycol, which is also found in your Moderna vaccine, polyethylene glycol and trometanim, or TRIS as we call it. While for the others, you have your polysorbate 80. Now for the 5 to 11 age group of vaccines that we're giving, as I've said, it contains the mRNA, but this time the excipients are your polyethylene glycol plus trometanim or your TRIS. No? So you might ask, what is TRIS? It's an organic amine proton acceptor and used as a biologic buffer in drugs for topical, enteral, and parenteral. So it's almost present around us. In fact, it's even used as a in our contrast media when we do diagnostic procedure. And it's almost present in almost majority of the cosmetics containing emulsifiers. Now, next slide, please. Now, let's look at the safety profile of our 5 to 11 experience in North America. As previously mentioned, they have given roughly 8.7 million doses of your COVID-19 vaccines containing the 10 microgram and had been administered as of December 19, 2021. The manufacturer's experience are the following. It's given 21 days apart, like what we're going to do here. What they experience are majority are reactogenic data from the V-Safe surveillance. It's a passive surveillance system in the US, which is different from your virus, no? Which is the same as that of your clinical trial results. Now, they found out that there were more reactions in the older age group, 12 to 15, compared to your 5 to 11. Now, there's one country near North US of A will be your Canadian experience. It's the National Advisory Council on Immunization, according to the Canada experience. They initially used the 30 microgram preparation for the 5 to 11, and then after having approval from their FDA to use their 10 microgram preparation for the 5 to 11. So what did they found out? They found they gave a total of 1.4 million doses administered for 5 to 11. That will be a mix from 10 microgram and 30 microgram. They only had a total of 116 adverse events, 56 males, 50 females, and 10 were unidentified. And vaccine safety monitoring still continued. And these are just mostly reactogenic reactions. Next slide, please. Now, in Singapore, the Health Science Authority documented roughly there were no serious adverse events reported for the 5 to 11 age group, as in comparison to they've learned their lessons from the 12 to 17, wherein they this time advised no vigorous activity after vaccination in order to prevent certain complications or cardiac complications such as myocarditis. Next slide, please. Now, here in the Philippines, the report of suspected adverse event from COVID-19 for the adolescent, which we have rolled out now. Remember, we started the rollout for the 12 to 17 in October 15, 2021. And for those with comorbidities, and then expanded it to all adolescents with or without comorbidities on November 2, 2021. Pfizer and Moderna were the only vaccines with EUA in the adolescent population. So next slide. This is the result. As of the 30 January 2022, there were 2,863 reports that were received. Out of the 2,863 reports, 153 were tagged as serious, 2,680 were non-serious, and 30 reports with no tag, whether serious or non-serious. Although myocarditis and pericarditis have been observed in this population, officially, the benefits of such vaccines still outweigh the risks. And The official number, there are 2 cases of myocarditis, 1 case of pericarditis that had been reported in adolescent population, and still the causal link of such cases to the vaccination are still being reviewed. With that, I would like to end my presentation and turn back the floor, virtual floor, to the moderator. Thank you.
Okay, thank you again to all our speakers, and good morning, everyone. I am Dr. Christine Aranz, member of the Public Relations Engagement Service System Services of the Philippine Pediatric Society, and I will be your moderator for today. But before we proceed, let me emphasize again that this media conference, in this media conference, we will entertain questions first from our media partners, and please be reminded that this conference is being recorded only by the organizers. Again, let's put our microphones on mute. For those who want to ask their questions live, you may raise your virtual hand and let me acknowledge you before you ask your question. Please try to limit your questions to 2 for the interest of time and so as we can give chance to others. Okay, may I call on again all our speakers? Let's put them on spotlight. And may we ask our speakers to open their cameras. All right. Good morning, everyone. Okay, let me start with here. We have a question from Red of Manila Times. You may open your camera as well, Red.
Ay po, okay lang po, hindi po ma-open yung camera ko.
Okay.
Docs, first question po, kamusta naman po yung ating vaccination in our areas po? Nakita ko po kahapon sa Philippine Children's, marami po mga batang may mga ilang po na umiiyak, na natatakot, na parang kailangan pang i-comfort ng mga magulang nila. So, pero overall po, how was the vaccination yesterday po in different sites across the country po? You can start po with Dr. Bunyi kasi siya po yung nandun sa PCMC kahapon.
Oo, nakita nga kita, Red eh. Nandun ka nga. Overall, maayos naman yung pagdaraos nung unang araw ng pagbabakuna laban sa COVID dito sa edad na to. Hindi mo talaga maiwasan, lalo na sa maliit na mga bata, na iiyak yan. So malaking bagay na maaaliw ang mga bata. Kaya nga kung maoobserbahan mo dun sa ibang mga lugar at ginawang vaccination sites, di ba? Parang kaaya-ayang tignan ng mga bata. May mga laruan, may mga mascot, may mga candy. Ganon din naman yung ginawa sa PCMC. Mas madali kasing makausap yung mas matanda compared sa mga 5, 6, 7. Although, pwede mo na silang makausap. Kahit naman umiyak sila nabakunahan pa rin. Wala kaming batang hindi nabakunahan kahit umiyak. Kasi may premyo sila pagkatapos bakunahan.
Tama. Yeah, if I may also share sa National Children's Hospital din, if I may share, we were able to give vaccination to a lot of children, and ang sabi nga ng mga magulang mas excited pa daw yung mga bata kesa sa mga magulang, no? And then katulad ng nasabi ni Dr. Bunyi, they're looking forward to yung kanilang sinasabing reward, no? So meron kaming mga loot of goodies for them, no? So meron pa nga kaming ginawa na tanong na ilang taon ka na? So sinabi niya 7 years old. So ilang chocolates ang gusto mo? 7. You know, so they are motivated, they are inspired kasi meron kaming ginagawa na parang reward system as well. But most of them, they know the reason why they want to get vaccinated. Okay, thank you.
Thank you, Dr. Josie. Now we move on to media. Who's this? Radio Aguila. Miss Annabelle. You want to ask your question? Please open your camera, ma'am.
Yes, ma'am. Hello po. I'm Bel Surara po. Okay po. Hindi ma-open yung camera. Okay lang po. So, ang tanong ko lang, hello po sa lahat ng doctors. Yung tanong ko lang, di po ba ang bawat age group o yung children po, hanggang ilang taon po siya? Di po ba may age bracket po? Curious lang po ako kung itong ibinigay nating bakuna, kung sakaling magbibigay pa po ng other vaccines for another age bracket po sa bata po, ito rin po ba yung gagamiting uri ng bakuna po kung ano po yung ginamit natin ngayon? Ibig ko po sabihin, in the future, pag nagdagdag po tayo ng babakunahan na another age group po, ngayon kasi 5 to 11 po. So, pagka po nagdagdag pa po tayo, ito rin po bang uri ng bakuna? And then po, follow-up question lang po, that sa nabakunahan na po, meron pa po bang gagawin na katulad po sa adult, may booster shot pa rin po ba? Yun lang po. Thank you.
Okay, so I guess your question is, yung una ay kung Pfizer pa din, yung ginagamit ngayon, kung ito rin ang gagamitin sa other age groups after our 5 to 11. Who wants to answer that question first? Probably.
Maybe me.
Okay, Doctor.
Sige, answer ko lang. Exciting kasi maraming ibang pharmaceutical companies are actually conducting their own clinical trials on vaccinating really the younger age group. So yun na yung focus ng marami. To name a few, Sinovac, Moderna, Astra, Janssen. So marami na pong mga Novavax. So marami na pong mga companies. So kung kailan sila magkakaroon ng enough data na pwede nating i-evaluate, kasi kami naman po bilang doktor, hindi naman po namin tinatanggap basta meron silang resulta. Siyempre po, i-evaluate pa po natin yan. And if it turns out na maganda din ang result nila, why not in the future? Pero sa ngayon po, Pfizer lang po ang merong enough data on the safety and the efficacy of the vaccine for the age groups for which we are recommending. So sa ngayon po, siguro hindi ko lang alam kung hanggang kailan natin makukuha kasi yung result ng iba, pero baka matagal-tagal pa. So ngayon po, mukhang Pfizer lang po muna ang maibibigay natin sa age group na to. With regards po naman booster, marami na rin po nag-aaral. In fact, ang Pfizer, nagre-recommend, nagsa-start na po silang mag-recommend ng booster sa mga 12 to 17. 12 to 15 yata, 12 to 15 kasi 16 yung kanilang adult eh. At pinag-aaralan na rin po yung younger. Pero sa ngayon, hindi pa po natin siya nire-recommend sa atin kasi nga po, kailangan pa pong dumaan sa masusing pag-aaral. So evaluate pa po natin yan. So booster in the 12 to 17 and in the younger, hindi pa po sa ngayon.
Okay. I think we have answered your question, Ma'am Annabelle. Okay, we'll move on to our next media partner. Yes, from Inquirer, Ms. Jane Bautista asked how can the education sector help in strengthening the COVID-19 vaccination campaign, especially in reaching out to parents and explaining the significance of vaccination to young students. So maybe we can ask first, our PPS President, Dr. Josie, and then probably from the standpoint of PMA, Dr. Benny.
Yeah, I think what we're doing now is one of the ways by which we can reach out also to all the educators there, no? But more specifically, the PPS also has a committee on school health. Maybe we can they can coordinate with the different schools all over the country, and we can share with them what we are doing right now, giving them the facts and the science behind the vaccines and the benefits of the vaccine. So we're going to do that. Thank you.
Thank you, Doc Josie. Doc Benny, do you want to add something?
Yes, as of now, since we started our Bulil Health Workers Project, we have may mga tinuro namin 25 years ago, ngayon mga doktor na ngayon. At pinagpapatuloy namin yung pagtuturo sa mga bata ng vaccination, hindi lang during this COVID. And we do hope nagkakaroon kami ng webinar for children po kasi meron po kami mga projects ng Philippine Medical Association. Involved po ang mga schools, ang ating mga bulilit at teen health workers from north to south. And we request nga po, Dr. Bunyi, baka pwede ka ulit mag-lecture sa mga bata. At ano po natin, FB Live yon sa Sabado.
Right. Okay. Sige, pag-iisipan ni Dr. Bunyi po yan. So habang we're preparing for that, let's answer some more questions. Now, Miss Jen Kaliman, I believe Miss Jen is from TV5. If you're here, if you want to ask your questions directly, you can open your camera and your microphone.
Hello, ma'am, sirs. Good morning. Hi po. May we get more information about MIS? MISC or yung multisystem inflammatory syndrome in children? Ano pong organ yung kalimitang naapektuhan po dito? Thank you.
Salamat, Miss Jen. Maybe Dr. Bunyi would like to answer.
Miss Jen, ang MISI is parang Kawasaki disease. Kung familiar ka sa Kawasaki disease, ang sintomas niyan ay halos pareho doon sa MISI. Ang kaibahan lang is that ang MISI is nangyayari pagkatapos magkaroon ng bata ng COVID. Whether nagkasakit siya or na-infect lang ng walang sintomas or naging banayad ang sintomas niya. So 2 weeks to 6 weeks after niyang magkaroon ng COVID-19 or even just being a close contact of a person who has been confirmed with COVID-19, pwedeng magkaroon ang bata ng MISI. Ano ba yung mga sintomas ng MISI? Kadalasan yan, bumabalik ang lagnat. Tapos, mas madalas ngayon na makikita nyo na pwedeng magtae, magsuka, or sumakit ang tiyan ng bata. Or pwede ring magkaroon ng mapulang mata. Or pwedeng magkaroon ng skin rashes. So yung mga sintomas na yan din yung nakikita natin kasi sa Kawasaki disease. Ang involvement ng MISI, mas maraming bata ang nagkakaroon ng sakit sa puso. So isa doon ay myocarditis. Kaya parati naming sinasabi, mas malaki ang panganib ng mga bata magkaroon ng myocarditis sa isang natural na impeksyon kesa magpabakuna sila laban sa COVID-19.
Thank you, Doc Mayan. I think Miss Jen has a follow-up question. Would you want to ask it or ako na po bang magbabasa?
Okay po, I can ask it na po.
Sige po.
Sige po, I have more questions po. Ma'am, what are the other medical issues about Pediavac? Totoo po ba nakakasakit yung ilang mga bata matapos mabakunahan? And also, ano po yung mga remedies po na pwedeng gawin ng mga magulang para sa mga anak po nilang makakaramdam ng mga adverse effects po ng bakuna? Thank you.
Okay, so regarding the adverse effects at saka yung mga, siguro we can ask Dr. Romel first regarding the adverse effects that i-expect natin sa vaccines for these children. Ha?
Yung pong mga adverse effects, dalawa po siya, pwede po siyang reactogenic na sinasabi natin na usually po na pwede nyo expect kagaya po ng mga injection site pain, tenderness, or sometimes po maglalagnat. Yung pong fever, pwede pong i-address yan ng paracetamol, pagbibigay po yan para po ma-address. Pero yung pong mga binanggit natin na mga symptoms, kadalasan po yan, within 1 or 2 days, they usually go away or resolve. Kung tumagal po yan ng more than several days, halimbawa 4 or 5 days, or mag-persist, then you have to see your pediatrician din after that. Kasi baka po merong iba na reason kung bakit po ganun. Kadalasan po, sinabi nga po natin, there's always a possibility of serious adverse event. Sinasabi po namin, pagka kami nagka-counsel after vaccination, wala po sila nararamdaman, sinasabi namin na they should avoid vigorous exercises po after vaccination within a few days to a week. Kasi po, dun sa 5 to 17, doon po sa 12 to 17 na study doon sa Health Science Authority ng Singapore, na meron po sila nakitang mga bata na athletic na nagkaroon po ng mga komplikasyon after vaccination kasi because of doing vigorous exercises. Kanya yun po yung isa sa pinaka-advice. And then, syempre po, pinag-uusapan natin yung possibility, no? Although very rare, sinasabi namin rare po siya. In fact, it's less than 1%. Sabi nga po ni Dr. Chet, 0.0003. Which is true. Talaga po yung pagka nga po nagka-counsel ako, sasabihin ko.
Romel 13. 0.000013.
O, 0013.
Five zeros daw eh.
Oo.
Oo nga po. Ang haba nga po ng zero. Kaya minsan, sabi po nila, pero kahit ganun po, no, kahit very rare, we usually advise the parent na to observe. For example, meron po sila, nagkaroon bigla ng chest pain. Yung activity lang nagbago, nagkaroon po ng hapo, nahihirapang huminga, nagkaroon ng abdominal pain. Yung po mga manifestation na unusual, mga 5 to 7 days, even 3 to 4 weeks after, you have to have your go to your pediatrician and explain to them na bakunaan po ito po ngayon ang nararamdaman niya para po magiging aware. Kasi kung hindi niyo rin po sasabihin na nabakunaan, na ganito po yung nabakuna, syempre po marami rin pong isipin yung pediatrician eh. Pero since ganito po yung history niya, mas matutulungan niyo po, mabilis po ma-resolve yung problema. Tsaka lahat po ng kadalasan po halos lahat ng myocarditis po na nagre-resolve po siya. In fact, wala nga pong standard of treatment kahit na po bigay nila, nagkakaroon ng resolution at saka wala pong namatay so far doon po sa sa North American experience. Yun po siya.
Okay, thank you, Dr. Mel. Actually, there's a follow-up question here from another doctor naman. Regarding athletic children, you've mentioned daw about athletes, no? Is there any recommendation daw, sir, how soon they can resume training after getting a vaccination for COVID?
Usually po, I would advise at least, ako po, just to be safe, meron din po kasing exercise-induced anaphylaxis eh. I would not even advise after vaccination, the exercise, pwede po magkaroon ng reaction. So usually po, mga 5 to 7 days after vaccination, saka nyo na lang po mag-resume ng vigorous activity just to be on the safe side po.
Okay, sir. Do we have a particular like how many days or how many weeks? Is there any recommendations on that already?
5 to 7 days po will be good enough. Ganyan po yung recommendation ng Health Science Authority ng Singapore po eh. Yeah.
Okay. Thank you very much, sir. So far, I don't see any hands raised here in the Zoom. So maybe I can start asking some of the questions from our YouTube and Facebook page po. Here's one from, I think, this is a parent, no? So sabi niya, my child who is 7 years old with allergic rhinitis and using nasal spray maintenance, is he allowed to be vaccinated? How about kids who have a known allergy or known allergies? Are they allowed to be vaccinated?
Definitely po, allergic rhinitis, asthma, as long as it's controlled, you need to be vaccinated. You have a chance of getting infected din po. Sometimes nga po, despite this COVID times, hindi nga po as an allergist, I don't usually advise them to stop using their maintenance medication kasi napapagkamalan din po na symptoms ng COVID pagka in-stop nila yon. So, hindi rin po contraindication yung allergic disease nyo. In fact, sometimes if it's asthma, it's a comorbidity that you need to be vaccinated. Allergic rhinitis po, hindi rin po siya contraindication. You can still be vaccinated. Even with food allergy, you need to be evaluated properly by a qualified physician, and then the examiner will give you a go signal to be vaccinated po. As long as you do not have any reaction to any component of the vaccine, you can be vaccinated po.
Okay. Thank you, sir. Another question here from Ms. Reyes. What do we tell, I think she's a doctor.
What do we tell parents who are concerned about the anaphylactic reaction from PEG in the vaccine? Maybe we ask Dr. Chet also, and then if Dr. Romel wants to add something pa.
Dr. Tin, parang kay Dr. Romel yan.
Sige, si Dr. Pinapapahinga ko lang sana si Dr. Romel eh. Pero sige, Dr. Romel, if you don't mind.
Ma'am, ganito po yan. Polyethylene glycol has several molecular weight. The higher the molecular weight, the possibility, if you reacted to a higher molecular weight, for example, 33,000, yung molecular weight, there are certain instances na nakikita nila at a lower molecular weight, hindi sila nagre-react. Hindi po sila nagkakaroon ng cross-reaction. So, kung pong meron allergy sa polyethylene glycol at na-evaluate po natin na talagang magre-react sila, we can shift to a different vaccine platform that does not carry the polyethylene glycol. Yun po yung recommendation. Ganun din po, evaluated by a qualified physician, then it's a shared decision making. If you want to be evaluated further, check natin, i-challenge natin with polyethylene glycol, or you just move to a different platform po. Yun po yung recommendation.
Okay. So I guess this next question will really go to Doc Chet kasi it's about efficacy, and you mentioned a while ago, diba, it's about 90.7 if I'm not mistaken. So yung question po dito, ma'am, is what is the vaccine efficacy again, considering these vaccines are less effective daw against Omicron?
Well, in general naman kasi, what we have noted among all the other vaccines is that although the efficacy against the variants are reduced, they are lower than against efficacy for like the original variants, for example, they are still effective. Hindi naman totally 0%, di ba? And that's the reason why in the older age groups and even in adults, we have been pushing for booster doses or third doses, if you would like to call it that, because it somehow increases the efficacy against the variants. Ito pong vaccine kasi na to for our particular age group, hindi pa po kasi natin alam. So we don't have data. I don't have data to say how effective it will be against the Omicron variant. So I'm sorry, we don't have data. Maybe later on we'll have more data.
Understand? Yes, that's right. So thank you, Doc Chet. Now we have another question here from Ms. Wena Cos of ABS-CBN. Ma'am, would you want to ask your question? Are you here? Are you still here?
Yes po, hi po.
Yes, ma'am. Okay po.
Sige po, hindi na po mag-share. I think nag-open yung video ko.
Yan,
Pero
okay
off ko po ulit. Mga docs, I'd like to ask lang din po sana, kasi si Doc Bunyi said that Miss C is very similar to Kawasaki disease. Could you also i-describe to us in layman's terms po, para mas maganda po kasi if manggagaling po sa inyo, since kayo po ang medical professional, ano po ba ang Kawasaki disease, ano po ba ang Miss C, ano po ang nangyayari sa loob ng katawan when a person or an individual has Miss C?
Okay, thank you very much, Ma'am Wena.
Thank you
Dr.
po.
Abuni, Doc Mean. Yes.
Pag sinabi natin Kawasaki disease, namamaga ang mga blood vessels, mga ugat sa loob ng katawan. Ganun din yung nangyayari, parang pareho ng mekanismo, ang nangyayari kapag ang bata nagkakaroon ng NISI dahil nagka-COVID siya or naging close contact siya sa isang taong confirmed with COVID. Kaya ang sintomas nila halos pareho. Sa Kawasaki disease, meron ding lagnat, may pamumula ng mata, may rashes, minsan nagtatae ang bata, yung labi niya pulang-pula, yung dila niya parang strawberry. Sa MIS-C, halos ganun din. Kaya lang, mas madalas doon may lagnat, nagtatae. Mas maraming sintomas na nakatuon sa tiyan. So masakit ang tiyan, nagtatae, nagsusuka. Meron din tayong makikitang mga bata na may rashes, hindi masyado yung namumula yung bibig at saka nagkakaroon ng parang strawberry na tang. Okay, tapos ang Kawasaki, mas madalas siya nangyayari sa mas batang edad, mas bata sa 5 taon. Dito sa MISI, kung mapapansin nyo, ang nakalagay doon na datos, mas common ito nakikita between 5 and 11 years old. Okay? Ang gamutan, pareho lang. Pareho naming binibigyan ng IVIG yan at steroids. Ganun din dito sa MISI. So ang mekanismo parang parehong namamaga ang ugat. Kaya maraming organs or parte ng katawan ang nai-involve in both medical conditions. Nasagot ko ba yung tanong mo, Wena? Mas maliwanag ba?
Yes po, mas maliwanag po, Doc. Maraming salamat po. Ano po yung mga early signs na lang po that parents should look out for? At ano po yung first step that they should do? Diretso ER na po ba agad kapag ganun? And then maybe we could also reiterate how low again po ang likelihood na mangyari po ang MISI from vaccines.
Okay. So yung sa MISI, ang una namang mapapansin ng magulang dyan, maglalagnat eh. Maglalagnat yan, so anong gagawin ng mga magulang, lalo na yung medyo maalam na, magbibigay muna yan ng paracetamol. Ngayon kung hindi mawala yung lagnat, tuloy-tuloy yung lagnat, at may napapansin pa silang ibang sintomas na para sa kanila ay mukhang kakaiba, siguro ang best tumawag muna sa doktor nila. Kung wala silang doktor, dalhin muna sa clinic. Wag emergency room agad. Pumunta muna sa isang clinic or tawagan yung kanilang mga doktor. Tapos para makausap nila ng maayos or ma-assess yung bata kung ano yung pwedeng gawin at obserbahan ng mga magulang. Ano pa nga ba yung isa mong tanong, Wena? Sorry. Ano yung pangalawa?
Ano po yung reassurance na lang natin na
okay,
bihira lang itong mangyari? Kahit na medyo nakakatakot po kasi siya eh. Pero ano po yung reassurance natin na very low lang po ang chance na mangyari ito?
Okay. Ang MISI, hindi yan ang MISI, pwedeng maiwasan yan kapag nabakunahan ng bata. Kasi ang MISI, isang nagiging komplikasyon yan eh, ng mga batang nagkakaroon ng COVID.
Yes.
Okay, whether ma-hospital sila, whether hindi sila nagkaroon sintomas, or banayad lang ang sintomas nila. Hindi natin alam kung sinong tatamaan ng MISI. Kasi kadalasan yan, 2 hanggang 6 na linggo bago lumabas ang sintomas. So ang pinakamainam na hakbang para hindi magkaroon ng ganyan, pabakunahan yung bata.
Right. Okay, so ma'am, let's just clarify, no, para sa lahat po nung nandito, that MISI, okay, hindi siya galing dun sa vaccine. Okay, it's a complication of getting the infection, of COVID infection. So
Yes.
para malinaw po sa ating mga media partners when they do their reports as well. Okay, so maraming salamat, Dr. Abunyi. But for the interest of time, maybe I can only ask one more question. And there's this question from the YouTube live. How soon can a child receive the vaccine if they tested COVID positive? So how soon they can get the vaccine after getting the infection? Gaano katagal po ba? Maybe who wants to answer? Sige. I can answer. Doc Mean muna.
Si Ma'am Chet.
Okay. So if you're positive for COVID, syempre, hindi muna kayo pupunta kung kayo ay naka-isolate kasi makakahawa tayo sa ibang bata. So ano ba ang isolation period na nga ulit dun sa mga unvaccinated? 10 days po. So wag po muna tayong lalabas ng bahay kapag tayo ay unvaccinated na tayo ay may COVID. So after po doon, ang sabi po nila, because the vaccines are not live, following the general recommendations ng vaccines, even sa US, wala na po silang hinihintay na interval. Kaya lang po tayo, dahil tayo po ay nag-iingat, mas maigi po kung ako po ang tatanungin at siguro ito din yung nabasa ko din yata to sa DOH recommendation din, na maghintay po muna ng 2 weeks bago po natin dalhin yung bata kung ako nga 2 weeks after recovery, bago natin po dalhin yung bata sa for COVID vaccine. Marami pong dahilan yan. One is, gusto po natin makasiguro na yung bakuna po, yung mga mararamdaman or makikita natin na side effect kung meron man, malinaw po sa atin at hindi natin mapapagkamala na pinagmulan niya ay iba pang dahilan. So, mas maigi po na kung hindi naman po siya urgent, kung hindi naman po siya urgent, pwede naman po maghintay ng 2 weeks bago po dalhin for COVID vaccine. Meron ka bang sasabihin? Baka iba yung iyong opinion.
Pareho lang tayo, Ma'am Chet. Ang naisip ko lang kasi, tama, mag-isolate kasi ang bata ng 10 araw. Kung halimbawa ang bata wala nang pinapakitang sintomas or nag-improve na siya sa kanyang sintomas at wala siyang lagnat ng 24 oras, pwede na siyang bakunahan after isolation. Or let's say naging close contact siya. Naging close contact siya ng somebody who has been confirmed with COVID. 14 days quarantine. After ng quarantine, then pwede nang bakunahan. Yan lang po.
Okay. Thank you, Doc Chet and Doc Mean. So before I wrap this up, may I ask a few last words na lang po from all our speakers again before I call on our PPS Press Chair for the closing remarks. Let's start with our PPS President, Doc Josie.
Thank you so much, Tin. So katulad po ng nabanggit ko kanina, ang lahat ng societies na nakikita ninyo ngayon, lalong-lalo na po ang PMA at saka ang Philippine Pediatric Society, ay katuwang po ng ating gobyerno para sa pagbabakuna po ng ating mga anak. At sinabi din po natin na maaring hindi ito ang makakapag-prevent talaga para sa kanila na magkaroon ng COVID, pero kahit pa paano, mapoproteksyonan sila na magkaroon ng malalang sakit sa COVID. Yun po yung gusto namin i-emphasize kasi ang laging contention po kung nabigyan ka ba ng COVID, hindi ka na magkaka-COVID. Hindi naman po ganun ang sinasabi namin. At base na rin po sa mga nasabi kanina, ito po ay safe and efficacious. Kaya po, wag po tayong matakot. Mga magulang, mahal naming magulang. Maraming salamat po.
Thank you, Ma'am Josie. Dr. Benny Atienza from PMA.
Yes po, sa lahat ng po nakikinig, especially sa ating sa media partners po natin. Sabi ko nga po, mula po tayo nag-start ng bakuna, matakot sa COVID, wag sa bakuna. At saka po, tanggalin po ang agam-agam ng mga magulang regarding sa vaccination. Pabakunahan po natin ang ating mga anak para maprotektahan po sila. At ang Philippine Medical Association po ay palaging nakikipag-ugnayan lalo po sa pagbabakuna ng mga bata sa Philippine Pediatric Society at Philippine Infectious Disease Society para mo pangalagaan at sinisigurado po na lahat po ng vaccination centers ay may mga doktor po doon para sila po ang mag-i-screen kasama po sa pagbabakuna at higit sa lahat ang magbabantay after pagbabakuna. At sana po ay maniwala kayo sa ating mga eksperto, lalo po sa ating media partners, maniwala po sa experts, naririyan po, pwede po kong tawagan at hingan po ng mga payo, lalo po yung mga magulang, paalam po lang ninyo sa inyong mga doktor at saka po sundin po natin ang protocol kahit na po tayo ay may mga bakuna na. Maraming salamat po at magandang umaga po sa inyong pagdalo.
Thank you po. Dr. Romel Lobo from PSI. You're on mute, sir.
Sorry, thank you. Magandang umaga po ulit sa inyong lahat. Iniimbitahan ko po kayo lahat na may mga pag-agam-agam. Yung pong website namin, www.psaai.org. Meron po doon ng mga guidelines para po nga sa doktor at saka para po to answer your questions regarding your questions in reference to vaccination or questions regarding vaccination reactions para po kayo'y ma-enlighten. And we hope that we're doing this in the hope that we encourage you to be vaccinated and let your children be vaccinated, because we all know that vaccine saves life. Vaccination saves life, hindi po vaccination, hindi vaccine. Yung pong pagbabakuna po ang nakakatulong sa atin para maging healthy tayo. Salamat po.
Salamat, Doc Romel. May I call Dr. Lisa Doc Chet from PFV.
Thank you. Doon po sa meron pa, nag-hesitate pa rin, natatakot pa rin. At ang kanilang desisyon ay maghintay o wag magpabakuna. So, ang feeling ko po kasi, naririnig po namin kayo, naiintindihan po namin, pero sana naririnig nyo rin ang mga sinasabi ng mga experts, yung scientific evidence. So, kami po kasi, nire-review po namin at ine-evaluate namin yung mga data, yung mga evidence. At hindi po kami magre-recommend nang hindi namin sigurado na magiging effective at safe sa mga bata. So kung ang alternative or ang option doon sa pag-vaccinate ay to do nothing or to continue to wait or to hesitate, medyo may risk din yon. At yung risk nun ay pwedeng magkasakit at pwedeng magkaroon ng malalang sakit at maospital at mamatay. Marami pong benefits ang pagbabakuna, direct at saka indirect. So sa health ng bata, sa kanyang mental at social well-being, marami po siyang effect sa family, sa economics ng kanyang situation ng pamilya, ng komunidad, ng bansa. Marami pong mga benefits na yung risk na mga kinatatakutan po ng mga iba ay talagang naman pong na-outweigh ng mga benefits na nakikita sa vaccination. So ang hope ko lang ay that you will always keep an open mind. Maybe we have not convinced you enough or you are not convinced enough, but just as we listen to you and we hear what you are saying, we hope that you will also listen to us and hear what we are saying. So thank you po.
Very much. And of course, Doc Mean Buni from PIDSP.
Magandang umaga po ulit. Ang bakuna laban sa COVID-19 nandito na sa atin. Kaya pwede na nating ibakuna sa mga batang may edad 5 hanggang 11 taon. Hinihikayat namin yung mga magulang na pabakunahan yung mga anak nila. At tandaan natin, ang pagbabakuna ay isang dagdag na sandata para maproteksyonan natin ang ating mga anak laban sa COVID-19. Ito na, nagsalita na yung mga eksperto. Kung ang tinatanong nyo ay tungkol sa kanyang bisa, eksperto, tungkol sa kanyang kung ito'y ligtas, nagsalita na sila na ito'y ligtas at mabisa. So sana po mawala na ang inyong pag-aalinlangan na mabigyan ng karagdagang proteksyon ang inyong mga anak laban sa COVID-19. Maraming salamat po.
Maraming salamat po ulit sa lahat ng ating speakers and media partners. Now, may I return the floor to the chair of the PPS Press Committee for the closing remarks, Dr. Carmela Casala. Thank you.
So thank you, Tin, and thank you, of course, to all our experts. And there you have it, ladies and gentlemen, direct from our experts. Vaccination is a proven preventive measure in the control and eradication of some of the life-threatening infections worldwide, including COVID-19. So ano pa ho ang iniintay natin, di ba? So but while the science may still be evolving, current studies have shown that the pediatric dose of Pfizer is safe and effective in preventing severe COVID-19 illness. Hence has been granted an EUA to be administered to 5 to 11 years old bracket. So the Philippine Pediatric Society, narinig niyo po, nag-issue na po ng joint statement with the Pediatric Infectious Disease Society of the Philippines in recommending this COVID-19 vaccination in 5 to 11 age group with a solid support from Philippine Medical Association, the Philippine Foundation of Vaccination, and the Philippine Society of Allergy, Asthma, and Immunology, today represented by their respective presidents. So we will continue to monitor vaccine safety and will provide updates as needed to guide COVID-19 recommendations in children. No? We do this all for the Filipino child. So thank you to our expert panel, Drs. Jocelyn Eusebio, Mary Ann Bunyi, Benito Atienza, Maria Lisa Antoinette Gonzalez, and Romel Lobo. What are friends for? We hope to see you also at the PPS Forum next week. Thank you to all our media partners who attended and participated in this media conference. May mga suki kami, may mga bagong kasama. Salamat po sa inyong tulong sa pagbibigay ng tamang impormasyon sa ating mga magulang at sa mga iba pa hong sa publiko na medyo nag-aalinlangan pa ho kung bibigay ba yung kanilang mga anak, mga chikiting nila, no? Kung bibigyan po ng bakuna. So, and thank you, of course, to the organizers, PPS Press, Child Health Informatics, the PPS Secretariat, and all the members of the Philippine Pediatric Society. Magkikita-kits pa rin ho tayo uli next week sa PPS Love Forum, wherein you can ask your questions about COVID-19 vaccination, yung ating mga members of the Philippine Pediatric Society. So thank you all for your time and attention. We may have gotten a little bit over time, just a little bit, but I'm sure the information that you bring home today is well worth the time and the attention. So mabuhay tayong lahat and God bless us all. Thank you. Okay, apat dapat. Okay, that's a wrap.
Congratulations.
Thank you, Doc Benny. We could not have done it without your support. And of course, thank you sa lahat ng ating mga speakers. For those who are still here, the invitation for next week's PPS Forum is, is going to go to you for the love of PPS. Diba? Okay.
Pwede nang umuwi.
Stop recording.